Hello, everyone. Today we're going over 75 NCLEX questions that commonly show up on the exam. And going through these essential questions will give you a solid understanding of the key topics. And not only will this boost your confidence, it'll also increase your chances of passing the NCLEX on your first try. Let's get started with the first part of our two sections. Question number one. A 54-year-old client with a history of diabetes mellitus and poor peripheral circulation has just completed treatment for cellulitis in their lower leg and is prepared for discharge. The client expresses concern about preventing future episodes of cellulitis. What should the nurse instruct the client to do upon discharge to help prevent cellulitis from occurring? A. Examine the skin between your toes regularly for any cracks. B. Soak your feet daily in warm water with Epsom salts. C. Wear thick white socks while doing yard work. And D. Apply mosquito repellent before going outside. The correct answer here is letter A. You need to teach your client to check their skin between their toes for cracks, which will help identify early signs of potential bacterial entry points, which is a common cause of cellulitis. The rest of the options, letters B, C, and D, are incorrect. We know that Epsom salt can dry out the skin, and this may create cracks that will increase the risk of cellulitis. And letter C is also incorrect because wearing thick socks doesn't directly prevent cellulitis. And letter D, the application of mosquito repellent is only useful for preventing insect bites, but it doesn't prevent cellulitis. Now, your strategy here is to look for that option that can directly address the prevention of bacterial infection or entry points, which is essential in cellulitis prevention. Number two, a nurse is supervising a newly assigned unlicensed assistive personnel who is applying compression stockings to a 76-year-old client with chronic venous insufficiency. Which action requires the nurse to intervene immediately? A. The UAP checks if two fingers can fit beneath the stocking's top edge. B. The UAP puts the stockings on while the client is sitting in a chair. C. The UAP elevates the client's legs before applying the stockings. And D. The UAP ensures the toes are warm after application. The answer here is letter B. The compression stockings should be applied when the client's legs are elevated, and this is to reduce blood pooling because applying them while the patient is sitting in a chair, this can result in improper fit and also will be less effective. Now, if you selected letter A, that is incorrect in this question because this action can help confirm that the stockings aren't too tight. And letter C, elevating the legs, is the correct procedure for stocking application. And letter D, the warm toes indicate good circulation. And this also suggests that proper stocking application has been done. Now, for this test question, your focus is on actions that indicate improper technique that will contradict the purpose of compression stockings. Question number three. A nurse is caring for a 62-year-old client recently diagnosed with DVT and prescribed low molecular weight heparin therapy. During the routine chart review, the nurse noticed that there were no recent PT, PTT, or INR lab results documented over the past 3 days. What should the nurse do? A. Proceed with administering the medication as prescribed. B. Contact the healthcare provider to report the missing labs. C. Order PT, PTT, and INR labs before giving the next dose. And D. Hold the medication until the healthcare provider completes their rounds. Your answer here should be letter A. The low molecular weight heparin does not require PT, PTT, or INR monitoring for therapeutic effect because it works with a short half-life and also predictable action. Now, the incorrect options here are letters B, C, and D because Notifying the provider is not necessary because these labs are not required for low molecular weight heparin therapy. Letter C, because monitoring these labs is not standard for this medication. And also letter D is incorrect. There's no need to hold the medication based on the lab results. Now, I want you to remember that low molecular weight heparin generally does not require frequent lab monitoring, unlike regular heparin. Number 4, a 20-month-old child with diarrhea has lost 4% of their body weight. Their serum sodium and potassium levels are 140 milliequivalents per liter and 4.8 milliequivalents per liter, respectively. What order from the primary healthcare provider should the nurse anticipate? A. Avoid all dairy products. B. Administer intravenous fluids with added potassium. C. Provide oral rehydration therapy. D. Serve buoyant soup for lunch and dinner. The answer here is letter C. The oral rehydration therapy, or known as ORT, is expected as it can effectively replenish fluids and electrolytes lost due to diarrhea. So your incorrect answers here are letters A, B, and D. For A, there's no indication to restrict dairy intake based on the child's condition. And for B, potassium is already normal at 4.8 milliequivalents per liter. Thus, additional potassium is unnecessary. And letter D is also incorrect. Bouillon soup is also high in sodium, which is not advisable given the child's condition. And knowing that the patient's serum sodium is already at 140 milliequivalents per liter, which is in the normal range. So you need to recognize here that isotonic dehydration requires fluid replenishment through oral rehydration therapy, which can provide balanced electrolytes and fluids for the patient's recovery. Number 5, a young girl is being discharged after a left nephrectomy due to stage 1 Wilms tumor and her first chemotherapy session. What should the nurse communicate to the parents during discharge planning? A. The child must limit fluid intake for life. B. The child will need dialysis until a kidney transplant is available. C. The child can expect to lead a normal life once the surgical site heals. And D. The child must take anti-rejection medications following surgery. The correct answer here is letter C. After a successful nephrectomy for stage 1 Wilms tumor, the child can have an excellent prognosis and they can lead a normal life once it's healed. So for letter A, this is incorrect. It is unnecessary to maintain fluid restriction since the remaining kidney can handle normal fluid intake effectively. And for letter B, this is also incorrect. Dialysis is not needed because the child still has a functioning kidney. And letter D is also incorrect because anti-rejection medications are only necessary after organ transplants, which is not applicable here as a child underwent a nephrectomy. So I want you to understand the specifics of Wilms tumor prognosis to provide a more accurate guidance and expectation for the patient's future care. Number 6, a nurse in a clinic reviews prescription refill requests from patients. When discussing with a healthcare provider which requests to prioritize, which refill should the nurse consider first? A. Hydroxyzine or Visceril 25 milligrams PO/TID PRN for a patient experiencing painful muscle spasms. B. Codeine 10 milligrams PO every 4 hours PRN for an adult with a chronic cough. C. Lorazepam or Ativan 1 milligram PO BID for an adult who has taken it daily for 3 years to manage anxiety. And D. Lamodal 2 milligrams PO every 6 hours PRN for a patient with severe diarrhea. The correct answer here is letter C. because we know that lorazepam is a benzodiazepine, and abrupt withdrawal of this drug can lead to serious complications, including the risk of death. And so we need to have this request done immediately. Now, for letters A, B, and D, these are incorrect options. We know that visceral can help manage the discomfort, but missing a dose isn't likely to lead to severe complications, so making it a lower priority compared to lorazepam. Letter B is also incorrect. Codeine is an opioid, and this can manage cough, but delaying its refill is not likely to result in significant health risks. And lastly, letter D is also incorrect because we know that diarrhea can be concerning, but this can be managed with increased fluid intake and over the counter options. Therefore, the refill request does not have the urgency compared to the lorazepam. So, in this test question, you need to prioritize the medication based on potential health risk associated with withdrawal symptoms or abrupt discontinuation. Number 7, a nurse is admitting a client for total hip arthroplasty who is on hydrocortisone for Addison's disease. What should the nurse prioritize? A. Providing an extra dose of hydrocortisone. B. Educating the client on coughing and deep breathing techniques. C. Gathering more information regarding the client's history with Addison's disease. And letter D. Placing an indwelling urinary catheter. The answer here is letter A. Preventing a acute adrenal insufficiency or adrenal crisis is the top priority for a client with Addison's disease undergoing surgical procedure. And so they need extra or supplemental doses of hydrocortisone during periods of increased stress. Now, if you're the nurse assigned to this patient, how are you going to implement this? Well, if you are admitting this patient, you really need to review their medical history and you have to identify their need for steroid coverage during surgery, and that's going to require them extra dose given the client's history of adrenal crisis. Now, what you need to do here after that, you have to proactively alert the admitting physician or the surgeon. Now, the rest of the options here, like letters B, C, and D, are incorrect. B, because while teaching coughing and deep breathing can help avoid post-op complications, it is not a higher priority compared to our option A. And the same thing with letter C, collecting additional history is important, but the immediate priority around this time is to address the patient's need for additional hydrocortisone dosage. And letter D is also incorrect. We know that the insertion of indwelling urinary catheter is also important to monitor urine output, but it's not the main concern here. So your task in this test question is to focus on identifying the priority nursing action, especially involving high-risk conditions such as Addison's disease and the crisis. Number 8, a nurse is educating a 23-year-old female patient with a severe UTI about ciprofloxacin. Which adverse reaction should the nurse highlight? Select all that apply. A. Monitor for pain and swelling in the Achilles tendon. B. Be alert for signs of a vaginal yeast infection. C. Anticipate excessive sweating at night. And D. Check for cottage cheese-like lesions in the mouth. And E. Take the medication with a dairy product. The answers here are letters A, B, and D. For A, pain and swelling of the Achilles tendon can indicate that this is a serious side effect of the ciprofloxacin, and the patient should report this to their healthcare provider. So actually, that's also an adverse reaction to the ciprofloxacin. Now, letter B, vaginal yeast infection can also occur due to the disruption of the normal flora when taking ciprofloxacin. And letter D, the presence of cottage cheese-like lesions in the mouth suggests that there is an overgrowth of Candida albicans, which is a adverse effect of the ciprofloxacin. Now, the rest of the answers here, letter C and letter E, are incorrect. For C, the changes in the perspiration are not typically linked to ciprofloxacin, while the common side effects include headache and dizziness. Now, for letter E, dairy products can interfere with ciprofloxacin absorption, and it should be taken either 6 hours before or 2 hours after consuming dairy. Next question, number 9. Due to a meningitis outbreak, the hospital must free up beds. Which client is the best candidate for discharge? A. A client newly admitted with chest pain and a history of heart attack last year. B. A client pre-admitted for shoulder surgery who has type 2 diabetes. C. A client recently admitted with pneumonia and dehydration. And D. A client with a hip fracture awaiting surgery tomorrow. The correct answer here is letter B, because this condition of this patient is stable and they're likely able to manage at home until a new surgery date is set, making them a suitable candidate for discharge. While letter A, this patient who has chest pain is at high risk of further cardiac complications and making them inappropriate for early discharge. And C is also incorrect because pneumonia and dehydration require close monitoring and also nursing care, indicating the client's need to stay in the hospital. And letter D is also incorrect because a client with a hip fracture is at risk of further injury without hospitalization and surgery. Now, in this test question, I need you to identify the client with the most stable condition who would require minimal or no immediate medical intervention if discharged. Number 10. A client with Parkinson's disease is admitted with a fever and patchy infiltrates on the chest x-ray. Which Parkinson's disease symptom likely contributes to these findings? A. Mask-like facial expression and shuffling gait. B. Swallowing difficulties and limited mobility. C. Finger tremors and lack of facial expression. And D. Decreased arm swing and slowed movements. The correct answer here is letter B. The difficulty in swallowing can raise the risk of aspiration, while their limited mobility can also increase susceptibility to pneumonia. And so these two factors contribute to respiratory complications. For letter A, this is incorrect because mask-like facies affect expression but do not directly cause respiratory issues. For letter C, this is also incorrect. The tremors and flat affect relate to motor control and do not increase pulmonary risk. And letter D is also incorrect because reduced arm swing and bradykinesia are movement-related issues without a direct link to respiratory infections. Your strategy here is to prioritize that answer that connects symptoms of a disease with secondary complications. So you have to focus on how the Parkinson's disease impact on swallowing and mobility, which can heighten infection risk. Number 11, a nurse is caring for a 58-year-old client who has been diagnosed with a new deep vein thrombosis. The healthcare provider has prescribed warfarin to start while the client is already on a continuous heparin drip. What is the nurse's best action? A. Start the warfarin alongside the heparin drip as directed. B. Hold the heparin drip once warfarin is initiated. C. Verify the order with the healthcare provider. And D. Obtain an INR before giving the warfarin. The answer here is letter A, because we know that warfarin takes several days to reach therapeutic levels. So it's necessary for you to continue the heparin until the warfarin reaches its therapeutic range. Now, B is incorrect because stopping heparin immediately would risk ineffective anticoagulation before warfarin reaches its therapeutic level. And C is also incorrect. The order doesn't need clarification because it's a standard procedure to overlap anticoagulants until warfarin is therapeutic. And letter D is also incorrect because INR monitoring starts after initiating warfarin therapy, not before. So your strategy here is to recognize that overlapping anticoagulants is common, especially in a case of a DVT, with the use of heparin, IV infusion, and also warfarin to maintain therapeutic anticoagulation. Number 12. A child weighing 82 pounds has received a prescription for an EpiPen. Which information should the nurse share with the child's parents regarding the medication? A. The medication must be injected into the outer thigh muscle. B. Store the EpiPen in the refrigerator at all times. C. Inject the medication at a 45-degree angle into the body. And D. Maintain the injection for at least 10 seconds. The correct answer here is letter D. The EpiPen should be injected for a minimum duration of 10 seconds to ensure proper delivery of the medication. While options letters A, B, and C are incorrect, because letter A, we know that the statement is true. It's not the focus of the teaching compared to the duration of the injection. For letter B, the EpiPen should not be kept refrigerated. It needs to be kept at room temperature and with the individual who may need it. And letter C is also incorrect because the correct angle for injection is 90 degrees, not 45 degrees. So your strategy here is to recall the proper use of the EpiPen, especially the correct technique in the self-administration, especially with the duration of the injection. Number 13. 14 years after their 2-year-old child died in an accident, parents place flowers at the site yearly. How should the nurse describe their behavior? A. Mourning. B. Bereavement. C. Complicated grief. D. Disenfranchised grief. The correct answer here is letter A. We know that mourning refers to the outward expressions of grief, and the act of visiting the annual ritual signifies an ongoing adaptive way to acknowledge their loss, indicating healthy coping. Now, if you selected letter B, bereavement refers to the state of having lost someone, but does not specifically encompass the active expression of grief, such as placing flowers, which is classified as mourning. And letter C is also incorrect because complicated grief applies to prolonged and debilitating grief, which doesn't apply here, as the parents are managing their grief in a healthy manner through ritual. And letter D is also incorrect because this term describes grief that is not acknowledged by society or others, which does not fit the parents' behavior of commemorating their child's memory as they are honoring their loss openly. Now, I want you to identify the behaviors that will signify the expressions of grief versus those indicative of unresolved issues. Number 14. A client experiencing chest pain states they are leaving the hospital immediately. What actions should the nurse take? Select all that apply. A. Ask the client to sign an AMA against medical advice form. B, notify the client's family of their intent to leave. C, inform the client of potential risks of leaving without medical clearance. D, prevent the client from leaving until the doctor arrives. And E, document the client's intent to leave against medical advice. The correct answers here are letters A, C, and E. If you selected letter A, having the client sign the AMA form can help protect the hospital from liability and also documents the client's decision. If you selected letter C, educating the client about the risk associated with leaving against medical advice is also a nursing responsibility. And letter E is also correct because documenting the client's choice to leave AMA provides a clear record of the situation. Now, if you selected letter B, this is incorrect because informing the family without the client's consent may violate confidentiality. The provider should be notified instead. And also, letter D is incorrect because when you're attempting to forcibly prevent a client from leaving, can result in legal issues, including potential charges of false imprisonment. So in this test question, you need to identify those options that protect the client's rights and the nurse's legal responsibilities in cases of AMA situations. Number 15. A 25-year-old client is being admitted to the hospital with suspected Hodgkin's lymphoma. The client reports several concerning symptoms and has a family history of lymphoproliferative disorders. Which symptoms would support this diagnosis? A, swollen lymph nodes in the groin area. B, fever and night sweats without chills. C, persistent fatigue and stomach upset. And D, neck pain following fatty meals. The correct answer here is letter B. We know that Hodgkin's lymphoma is characterized by night sweats, fever without chills, and also weight loss. And the initial symptoms can include painless enlargement of a cervical lymph node. The other options, like letter A, swollen lymph nodes in the groin area, it's incorrect because in Hodgkin's lymphoma, it mainly affects the neck lymph nodes rather than the groin lymph nodes. Letter C is also incorrect because we know that fatigue may occur. But upset stomach is not commonly associated with Hodgkin's lymphoma. Now, letter D is also incorrect. Pain after consuming alcohol may occur, but after fatty meals is not a typical symptom. So, you need to look for the keywords like groin and fatty to identify potential mismatches with the characteristics of Hodgkin's lymphoma. Number 16. A woman in her third pregnancy is receiving an IV infusion of oxytocin pitocin at a rate of 3 milliunits per minute. Her contractions are occurring every 3 minutes, lasting for 45 seconds, and have a moderate intensity. The fetal heart rate is steady at 150 to 160 beats per minute with moderate variability. What action should the nurse take at this time? A, administer oxygen through a face mask. B, adjust the client's position. C, continue to monitor the labor process. D, discontinue the oxytocin infusion. Your answer here should be letter C. The contraction pattern, fetal heart rate, and the variability in this scenario are all within the normal parameters, indicating that the labor is progressing well. So in this case, it is appropriate for the nurse to keep monitoring without making additional interventions. Now, letter A is incorrect because there is no indication of fetal distress or abnormal maternal signs requiring oxygen support at this time. And same thing with letter B. This is incorrect. Adjusting the client's position is unnecessary at this point since the patient is comfortable. And letter D, there is no indication to stop the Pitocin as the current contraction and fetal monitoring patterns are within the safe and expected range. So for you to answer this question correctly, you need to focus on recognizing the normal patterns in contraction frequency, the intensity, and fetal heart rate variability. So you should only take additional actions if there are signs of fetal or maternal distress. Number 17. A 7-year-old child has been prescribed 20 micrograms of Desmopressin intranasally, which is 10 micrograms in each nostril, to manage nocturnal enuresis. What essential information should the nurse share with the child and their parents? A. The child must drink at least 5 cups of fluid daily. B. The medication should be kept in the freezer until needed. C. The prescribing healthcare provider should be informed of severe headaches accompanied by blurred vision. And D. The spray should be administered while the child is lying down. The answer here is letter C. Severe headaches and blurring of vision can indicate an overdose, and it warrants immediate notification of the healthcare provider for potential dosage adjustment. If you selected letter A, this is incorrect because fluid intake should be limited, especially before bedtime, to avoid excessive urination. Letter B is also incorrect because we know that Desmopressin should be refrigerated but not frozen. And D is also incorrect. The child should be sitting upright and the nasal spray should be held vertically for proper administration. Number 18. A client in critical condition reportedly has a do not resuscitate order with their primary care provider. What should the nurse do next? A. Assume the DNR is active and do not perform resuscitation if needed. B. Make a note on the order sheet to have the DNR reconfirmed. C. Record a DNR in the client's chart based on the family's report. D. Call the provider to verify an active DNR order. The correct answer here is letter D. Contacting the healthcare provider can ensure verification of the DNR status, and it will safeguard that the client's end-of-life preferences are also respected. Now, if you selected letter A, this is incorrect because without a documented DNR order, the nurse must initiate resuscitation to adhere to a standard protocol. If you selected letter B, this is also incorrect. Writing a reminder note could delay confirming the DNR order. And letter C, only a provider can officially document a DNR. Nurses cannot place such an order independently. So your strategy here is to select that option that can validate critical information directly from the medical provider to avoid assumption-based actions. Number 19. A client with Parkinson's disease is discharged with a prescription for carbidopa, levodopa, cinnamate. Why are these medications combined? A. Fewer side effects occur with a combination compared to carbidopa alone. B. Both drugs are required for dopamine to be effective. C. Carbidopa allows more levodopa to reach the brain. And D. Carbidopa crosses the blood-brain barrier to treat Parkinson's disease. The answer here is letter C. The carbidopa prevents peripheral breakdown of levodopa, thus increasing its availability to the brain, and it will also enhance its effectiveness in managing the Parkinson's symptoms. Now, if you selected letter A, this is incorrect because carbidopa is not administered alone. It's used together with levodopa to enhance effectiveness. Now for letter B, this is also incorrect because levodopa alone can act as a dopamine precursor rather. Carbidopa does not directly contribute to dopamine production. And letter D is also incorrect because carbidopa does not cross the blood-brain barrier, but it facilitates the levodopa's effectiveness in the central nervous system. So you need to recall the function of the combined medications in this question. So you need to eliminate those other options that misunderstand the drug's mechanism. Number 20, a nurse facilitates a bereavement support group. Which participant's statement indicates that they have successfully completed the grieving process? A, I wish we had more time together. I regret we didn't do more things. B, I realize our life together was a blessing, but I wish I had expressed my love more often. C, others saw my loved one as a kind person. I hope I can be viewed the same way. And letter D, our best vacations were by the water. Looking at ocean pictures brings back those memories. The correct answer here is letter D, because with this client's ability to recall fond memories without expressing regret actually indicates that the grieving process has been successfully navigated. And the person here can also remember both the positive and negative aspects of the relationship. Now, if you selected letter A, this is incorrect because this statement shows ongoing regret and a sense of unfinished business, which indicates that the person may still be working through their grief. And letter B is also incorrect because this response reflects guilt and also unresolved feelings, suggesting that the individual is still processing their grief rather than having completed it. And letter C is also incorrect because this statement shows a desire for external validation and comparison, which also indicates that the person is still navigating their feelings about the loss rather than having reached the acceptance. So in this test item, you need to look for the signs of acceptance and the ability to reflect on memories, possibly as indicators of completed grief work. Next item, 21. A 6-year-old child with a diagnosis of acute post-streptococcal glomerulonephritis and elevated anti-streptolysin antibodies is admitted to the pediatric unit. Which type of room is most suitable for this child? A private isolation room with droplet precautions. B, a private isolation room with droplet and contact precautions shared with a child who has bronchiolitis. C, a shared room with an 8-year-old child in traction for a fractured femur. And D, a shared room with a 6-year-old child managing diabetes. The answer here is letter C, because this option is appropriate because children in the early phases of acute glomerulonephritis often experience fatigue and their need to remain in bed. And so a child in traction would also be confined to bed, making it a suitable arrangement. Now, if you selected letter A, isolation is not necessary since the child's cultures are negative. And also B, this is incorrect. The same reasoning in A applies. Isolation is not needed due to the negative cultures. Letter D is also incorrect. While this child is the same age, those with diabetes may have different activity levels and could also pose a risk of increased activity compared to a child in traction. So, your task in answering this question is to consider all aspects of each child's condition. When you're assigning rooms, you got to focus on growth, development, the activity levels, and infection transmission risks. Next item, number 22. A nurse is instructing a client on metronidazole about adverse effects to report. Which one is a priority to notify the provider? A. Dark urine. B. Metallic taste. C. Difficulty coordinating movements. D. Nausea. The answer here is letter C. Ataxia, or the difficulty in coordinating movements, is a sign of central nervous system toxicity brought by the metronidazole, and this requires immediate reporting. If you selected letter A, dark urine is common and non-urgent. If you selected letter B, metallic taste, is also incorrect because this is expected and it doesn't need urgent reporting. Letter D is also incorrect because nausea is a typical side effect and also non-urgent. Nausea is also an adverse effect. Now, I want you to identify the most urgent adverse effect to report, but here you need to focus on the CNS toxicity signs over common adverse effects. Now, let's have our item number 23. A newborn delivered 24 hours ago to a mother who did not receive prenatal care shows tremors, frequent sneezing, continuous rooting behavior, and high-pitched cry. The baby's blood glucose is within normal limits. What test should the nurse recommend the pediatrician to order? A. Biophysical profile. B. Urine toxicology screen. C. Blood gas analysis and oxygen saturation. D. Ultrasound for chest and abdomen. The correct answer here is letter B, because the baby's symptoms, such as the tremors, the high pitched cry, are commonly seen in neonatal abstinence syndrome, or what we call as NAS or NAS, which results from drug withdrawal in newborns. And if you selected letter A, this is incorrect because a biophysical profile is an assessment done during pregnancy to evaluate fetal well being, and it's not relevant for this already delivered newborn. Now, if you selected letter C, is also incorrect because there are no signs of respiratory distress in this baby. So, testing blood gases and oxygen saturation is also unnecessary. Now, if you select the letter D, this is incorrect because this baby has not shown any signs of issues with chest or abdominal structures, making an ultrasound unwarranted in this case. Now, your test taking strategy here is to focus on the presented symptoms, noting that while tremors in a newborn can suggest hypoglycemia, but the normal glucose level rules this out. And so the remaining symptoms point toward drug withdrawal, making a urine toxicology screen the most logical test to confirm possible NAS. Let's have number 24. In the emergency department, a child with a head injury is to be discharged. The caregiver who smells of alcohol is to monitor the child hourly. When should the nurse intervene to delay the discharge? A. The caregiver mentions not having insurance or funds for a follow-up appointment. B. The child says, I have a headache and I just want to go home. C. The nurse notices an alcohol odor on the caregiver's breath. And D. The caregiver expresses anxiety about the home care and requests overnight observation. The answer here is letter C, because the odor of alcohol on the caregiver suggests possible impairment, which could jeopardize the child's required hourly monitoring. Letter A is incorrect because financial or insurance issues do not justify delaying discharge, but may necessitate social service involvement. And letter B is also incorrect because headaches are common after head injuries, and this symptom alone does not prevent discharge. And letter D, Addressing the caregiver's fears with guidance in home monitoring and contact information can support discharge readiness. So, your strategy in selecting the correct answer is to focus on safety considerations that might directly compromise post discharge care. Number 25. A nurse is caring for a client on ritonavir, a protease inhibitor for HIV treatment. Which adverse effect should the nurse closely monitor? A. Reduced ALT levels. B. Increased TSH levels. C. Low blood sugar. D. Elevated cholesterol levels. The correct answer here is letter D, because ritonavir commonly causes increased cholesterol and triglyceride levels, requiring for monitoring regarding hyperlipidemia. Now, letter A is incorrect. We know that ritonavir can raise ALT and AST levels. It does not reduce them. Letter B is also incorrect. Hyperthyroidism is unrelated to ritonavir use. Letter C is also incorrect, because ritonavir may actually raise the blood sugar levels, leading to hyperglycemia, not hypoglycemia. So your task here is to focus on the adverse effects, specifically to protease inhibitors, especially metabolic changes like lipid elevations. Number 26. A patient who had a stroke 3 days ago expresses hopelessness, saying, "What's the point in living? I'm useless like this." What should the nurse do first in response to this display of hopelessness? A. Start the institution's suicide risk protocol. B. Help the patient clarify and express their feelings of grief. C. Educate the patient on stroke rehabilitation success. And D. Offer to connect the patient with a pastoral counselor. The answer is letter A. The patient's expression of hopelessness actually is a sign that they are suicidal, and we need to immediately implement the suicidal precautions in order to ensure their safety. If you selected letter B, this is incorrect, because we know that this is important though, but it does not address the urgent risk of suicide implied in the patient's statement. We need to implement safety first. Now, option C is also incorrect. We know that this can help motivate the patient, but it is not appropriate as a first response when the patient expresses hopelessness, which suggests potential suicidal thoughts. Now, letter D is also incorrect. We know that spiritual support is beneficial, but it does not address the immediate need for suicide risk assessment and management. So we need to implement the safety protocols in this case. Now, your task here is to prioritize safety and suicide risk assessment, especially in patients displaying signs of hopelessness. Number 27. A child who is not vaccinated has a serious puncture wound and is diagnosed with tetanus. What action is essential for the charge nurse to take? A. Ensure the child is placed on contact isolation. B. Reinforce padding on the side rails and headboard of the child's bed. C. Only allow fully immunized nurses to take care for the child. D. Order a cooling mattress and antiviral medications for the child. The answer here is letter B. Since the child is at high risk for seizures, it's very important for you to pad the side rails and also the headboard to prevent injury. If you selected letter A, this is incorrect, because tetanus is not a contagious disease. It does not require isolation precautions. Letter C is also incorrect because tetanus is not transmitted from one person to another. Thus, immunization status of caregivers is not relevant. Letter D is also incorrect because tetanus is caused by a bacterial infection, not a viral one, and it does not require antiviral treatment. So, you need to recognize here the specific safety measures required for a child with tetanus, and you need to prioritize seizure precautions and also preventing child injury. Number 28. A 45-year-old male client was admitted to the hospital following a motor vehicle accident that resulted in a hemothorax. 3 days ago, 2 chest tubes were inserted to facilitate drainage and promote lung re-expansion, which assessment finding indicates they've been effective. A. The water seal compartment shows no tidling. B. The client reports deep breathing without pain. C. The suction chamber shows gentle bubbling. And D. There is 250 mLs of blood in the drainage chamber. The correct answer here is letter A. The lack of tidling in the water seal compartment usually means the lung has re-expanded, which indicates that the treatment has been successful. If you selected letter B, this is incorrect. While lack of pain during deep breathing is positive, it doesn't confirm lung re-expansion. Letter C is also incorrect because gentle bubbling in the suction chamber shows that suctioning is working but does not confirm re-expansion. D is also incorrect because blood in the drainage chamber is expected for a hemothorax, but it does not indicate that the lung has re-expanded. Now, recall that tidling cessation in the water sealed chamber indicates that the lung has re-expanded, and this is a basic knowledge for interpreting chest tube function. Number 29. A 24-year-old client with a known history of sickle cell disease presents to the emergency department with fever and chills. For a client in a sickle cell crisis, which intervention should the nurse anticipate or implement? A. Administer Demerol via IV. B. Admit to a private room and implement reverse isolation. C. Start D5 water 0.33% normal saline at 150 mLs per hour on a pump. D. Insert a 22 French Foley catheter with a uremitter. The correct answer here is letter C. Increasing IV fluids will help dilute the blood, and this can also reduce the sickling by preventing dehydration. If you selected letter A, this is incorrect because Demerol is not recommended for pain in sickle cell crisis because of the risk of seizures from metabolite buildup. B is also incorrect because reverse isolation is not specifically required for a patient in sickle cell crisis. While clients with sickle cell disease are prone to infections, isolation is not really a routine intervention solely for managing a crisis. We know that during a sickle cell crisis, the focus here is to relieve the pain, also to promote hydration, promote oxygenation, and to prevent complications rather than implementing isolation precautions unless there is specific active infection that warrants it. Now, letter D is also incorrect because the monitoring of the urine output is not really, the use of a Foley catheter this time to monitor intake and output is not specifically indicated. Now, for you to answer this question correctly, you need to recall that dehydration can worsen sickling, and it will help you guide in selecting that option that will um, have that administration of fluid as the best response. Okay. Again, our focus here is the hydration. The next item, a patient who was hospitalized for major depressive disorder completed suicide 1 day after discharge. Recognizing potential reactions among the staff, what should the nursing supervisor do first? A. Provide a confidential space for staff to express their feelings about the incident. Or B. Evaluate each staff member individually for suicidal thoughts or plans. C. Remind staff that suicide is common in this patient group and that they are not to blame. And D. Organize a guest speaker to discuss suicide risk factors with staff. The correct answer here is letter A. The staff members are likely to experience trauma from the event, and providing a private setting to share their feelings can allow them to process their emotions, which is critical for healing. Now, if you selected letter B, while staff may have intense feelings, individually assessing them for suicidal thoughts is not the priority. What needs to be done here is a collective debriefing, which can be more beneficial initially. Now, if you selected letter C, is also incorrect. While reassurance is important, it may be premature without first allowing the staff to express their emotions. And addressing feelings of responsibility should follow a supportive session. Now, letter D is also incorrect because educational sessions can be helpful, but are not the immediate need after a traumatic event. The priority here is emotional support rather than additional information. So, your focus here is on providing emotional support and opportunities for staff to express their feelings in the aftermath of a traumatic event. Let's have number 31. A 45-year-old client with a recent diagnosis of Buerger's disease expresses concern to the nurse about the impact of their smoking habit on their condition. What is the best response for the nurse to provide? A. Smoking could lead to severe circulation problems that result in amputation. B. Attending a smoking cessation program might be helpful for you. And C. Let's discuss your concerns about quitting smoking in more detail. And D. Continued smoking could lead to a heart attack due to blocked arteries. The answer here should be letter A. Smoking can aggravate Buerger's disease, which can also lead to worsening of vascular complication and also increases the risk of amputation. Now, if you selected letter B, this is incorrect because while smoking cessation is beneficial, but this response doesn't address the question directly. For letter C, this therapeutic response does not answer the client's specific question. Letter D is also incorrect because Buerger's disease primarily affects the peripheral arteries, not the coronary arteries. Now, your task here is to choose that answer that directly addresses the client's question, especially when discussing potential progression of the disease. Number 32. A nurse is educating a client newly prescribed oral nucleoside reverse transcriptase inhibitors, NRTIs, abacavir, lamivudine, and dolutegravir for HIV. Which statement should the nurse include? A. These drugs stop HIV from entering the cells. B. These drugs work by weakening HIV's cell wall. C. These drugs inhibit an enzyme to prevent HIV from replicating. And D. These drugs block protein production within the HIV cell. The answer here is letter C. These drugs inhibit an enzyme to prevent HIV from replicating. Actually, these medications can stop DNA synthesis, which will halt viral replication. If you selected letter A, blocking HIV entry is the action of fusion, or what we call as entry inhibitors like infuvertide. Letter B is also incorrect because weakening the cell wall is a mechanism used by antibiotics, not antiretrovirals. Letter D is also incorrect because blocking protein synthesis is an action of some antibiotics, but not the nucleoside reverse transcriptase inhibitors. Let's have number 33. A client with a hematocrit of 20% and a hemoglobin of 7.5 per deciliter is prescribed 2 units of packed red blood cells. What steps should the nurse take? Select all that apply. A. Obtain assigned consent. B. Start a 22 gauge IV. C. Assess lung sounds. D. Check for allergies. And E. Start D5 water IV at KVO rate. The correct answers here are letters A, C, and D. We know that consent is very important, and this is required for blood transfusions due to associated risks. Letter C is also correct. We need to monitor the lung sounds, which can help detect fluid overload, which is a possible side effect of blood transfusions. Letter D is also correct because allergy assessment is crucial. Some clients may require pre-medications to prevent reactions. Now, if you selected letter B, this is incorrect. IV size, such as gauge 20 or larger, is needed for blood products to avoid damaging the red blood cells. E is also incorrect. We should only be using normal saline or 0.9% sodium chloride with a blood transfusion, as we know that D5 water may cause hemolysis of the red blood cells. Now, let's have number 34. A nurse develops a care plan for a patient with schizophrenia who displays auditory hallucinations. Which intervention should be the nurse's priority? A. Encourage the patient to describe the content of the hallucinations. B. Teach the patient about the importance of medication adherence. C. Create a quiet environment with minimal stimuli. And D. Validate the patient's feelings and provide reassurance. The answer here should be letter C. A calm, quiet environment can help reduce external stimuli, which can help minimize the patient's distress caused by the hallucinations. If you selected letter A, this is incorrect because this could inadvertently reinforce the hallucinations and may lead to increased anxiety. And so, minimizing stimuli is more effective initially. Letter B is also incorrect, as we know that education is essential, but it is not as immediately beneficial as creating a peaceful environment, particularly when the patient is experiencing distress. Now, letter D is also incorrect. We know that this is important, but it is secondary to ensuring a safe and calming environment in the presence of active hallucinations. So, for this test question, you need to prioritize interventions that address immediate safety and comfort when a patient exhibits severe psychiatric symptoms. 35. A parent of an infant in the NICU is curious about why the other baby next to theirs, whose parent has diabetes, was fed shortly after birth. Why is it critical to feed infants born to parents with diabetes quickly? A. This helps eliminate thick mucus from the lower intestines. B. It helps or it prevents a drop in blood sugar levels. C. Their stomach may be larger than typical due to excessive growth. And D. The birthing parent likely did not eat during labor. The answer here should be letter C. The nurse should explain that if a parent has high blood sugar during pregnancy, their newborn is at a higher risk of being larger than average. And these baby may experience lethargy due to low blood sugar after birth, which can be a stressful situation for the infant. Now, letter A is incorrect because early feeding is not aimed at clearing mucus from the intestines. It focuses on managing the newborn's blood sugar levels, which can be low due to increased insulin production after birth. Now, letter B is incorrect. While we know that early feeding does help stabilize blood sugar levels, the term a drop in blood sugar levels basically does not accurately apply here. The goal is actually to maintain stable glucose levels rather than address a sudden drop or preventing a drop in their sugar levels. Now, if you selected letter D, it's also incorrect because newborn feeding is based on the infant's metabolic requirements, not the parent's intake during labor. And the aim is to manage the newborn's blood glucose, not to compensate for the parent's dietary habits. So, your task in this test question is to focus on metabolic needs of the newborn in the context of maternal diabetes. So, this will help you understand early feeding's role in blood sugar stabilization. Let's have number 36. A 62-year-old client with a history of subclavian steal syndrome recently underwent surgical intervention to alleviate the obstruction of the subclavian artery. Postoperatively, the nurse is monitoring the client for signs of complications related to circulation and neurological function in the upper extremities. Which assessment finding should prompt immediate action from the nurse? A. Strong bounding pulse in the client's brachial artery. B. Client reports numbness in their right hand. C. Capillary refill time is under 3 seconds. And D. Absence of a pulse in the left foot. The answer here is letter B, because subclavian steal syndrome can result from an obstruction or narrowing of the subclavian artery, typically impacting blood flow to the upper extremities, and the neurological symptoms such as numbness in the hands indicate potential compromised blood flow and will require prompt intervention. Now, the rest of the answers here, like letters A, C, and D, are incorrect. We know that a strong brachial pulse is expected and it does not require immediate intervention. Letter C, normal capillary refill time less than 3 seconds indicates adequate peripheral circulation. And D, subclavian steal syndrome affects the upper, not the lower extremities. Therefore, the pedal pulse is not relevant. So I want you to look for the signs directly linked to the affect area. And in this case, the upper extremities due to subclavian artery involvement. Number 37. A nurse is caring for an elderly client diagnosed with hypothyroidism who has been prescribed levothyroxine. What dosage schedule should the nurse anticipate for this client? A. The client will begin with a high dose that will be reduced as necessary. B. The client will stay on the initial dosage throughout treatment. C. The client's dosage will be modified daily based on blood tests. And D. The client will start with a low dose that can be gradually increased. The answer here is letter D. Levothyroxine should be started at a low dose and progressively increased over several weeks, especially in older adults, to prevent toxicity. Now, letter A is incorrect. because starting a medication at a high dose may lead to adverse effects. The same thing with letter B. This is incorrect because the client's dosage will likely change periodically during treatment. And letter C, while the dosage will depend on blood levels, daily adjustments are not typically required. Now let's have item number 38. The nurse and LPN are caring for clients on an oncology floor. Which client should not be assigned to the LPN? A. Client who had a bone marrow biopsy 4 hours ago. B. Client newly diagnosed with chronic lymphocytic leukemia. C. Client who received 2 units of blood in the previous shift. And D. Client receiving multiple IV piggyback medications. The correct answer here is letter B. Newly diagnosed clients require detailed education about their condition and also their treatment options, which is a responsibility of the registered nurse and should not be delegated to an LPN. A is incorrect because an LPN can monitor a client post biopsy, and this is a stable task. With letter C, monitoring a client post transfusion is within the LPN scope as the transfusion has already been completed. And letter D, LPNs are also qualified to administer IV piggyback medications provided they are stable clients. And actually, it's not administering IV, but client receiving multiple IV piggyback medications, which are administered by the RN, not administered by the LPN. Now, I want you to remember that the client education, the assessment, and evaluations are responsibilities that should not be delegated to an LPN. Let's have number 39. A nurse is monitoring a 12-month-old child who has just received the first MMR vaccine. Which potential adverse effects should the nurse instruct the family to observe for? Select all that apply. A. Skin rash. B. Swollen lymph nodes. C. Bruising. D. Head pain. E. Uncontrollable crying. The correct answers here are letters A, B, and C. A. The skin rash and fever may occur in children 1 to 2 weeks after receiving the MMR vaccine. And for letter B, there's going to be swelling of the lymph nodes, which can appear 1 to 2 weeks after they receive the vaccination. And letter C, a decrease in the platelet count, which can lead to bruising, can occasionally happen after the MMR vaccination. Now, if you select the letter D, this is incorrect because headaches are more commonly associated with the influenza vaccine rather than the MMR. And letter E is also incorrect. And controllable crying is more often observed after the DTaP vaccine, not MMR. Let's have number 40. A 38-year-old female client with Hodgkin's lymphoma asks about her prognosis. What is the nurse's best response? A. The outcome with standard treatment is generally positive. B. Enrolling in an investigational treatment program can help improve your survival chances. C. Survival rates are low, with over half of clients dying within 6 months. And D. Hodgkin's has a good prognosis initially, but secondary cancers often appear within a year. The correct answer here is letter A. Hodgkin's lymphoma generally responds well to chemotherapy and radiation with high survival rates, especially when treated with standard therapies. If you select the letter B, this is incorrect because standard treatment is typically effective and investigational therapies are not recommended initially. Letter C is also incorrect because Hodgkin's lymphoma often has a favorable prognosis with appropriate treatment. And letter D is also incorrect because secondary cancers can occur long after initial remission, often years rather than within a year. So I want you to eliminate the options that suggest investigational therapy or poor outcomes, which are inconsistent with known prognosis for Hodgkin's lymphoma. Test item number 41. The parents of a boy diagnosed with mumps are inquiring about any special care they should provide. Which responses would be suitable for the nurse to give? Select all that apply. A. Provide soft foods for the child. B. Encourage daily consumption of citrus juices. C. Closely monitor the child for signs of testicular discomfort. D. Use ice collars or warm compresses on the child's neck. And E. Administer prescribed antihistamines throughout the duration of the illness. Your answer should be letters A, C, and D. Letter A, soft foods are advisable since children with mumps may find it painful to chew hard foods. Now, for letter C, this is also correct. You need to closely monitor the child for signs of testicular discomfort. This is a possible complication of mumps, which will necessitate careful observation. Now, for letter D, use ice collars or warm compresses on the child's neck. This will help relieve the discomfort in the neck area associated with the mumps. Now, if you select the letter B, this is incorrect. Citrus juices can irritate the throat, so they should be avoided in children with this type of condition. And letter E, administering antihistamines are not indicated for the treatment of mumps, as it is a viral infection. So your strategy here is to focus on those actions that can provide supportive care that can alleviate the symptoms and avoids irritants during the viral infection. Let's have number 42. A nurse manager is discussing the audit process with the nursing team. Which of the following points should the nurse manager emphasize? Select all that apply. A. An outcome audit assesses the results of care provided to clients. B. Following data collection, it is compared to a predetermined benchmark. C. A structured audit assesses the environment and available resources for care. D. Retrospective audits occur while clients are still receiving care. And E. Root cause analysis is conducted when a sentinel event occurs. The answer should be letters A, B, C, and E. Letter A is correct because an outcome audit evaluates the effectiveness of care by examining measurable outcomes such as patient health improvements. Letter B is also correct because after gathering audit data and comparing it against the benchmark is essential to measure care quality. And letter C, structured audits review the settings, equipment, and also personnel available, which will support optimal care delivery. And letter E, root cause analysis is also necessary for understanding serious events like sentinel events, which can help prevent similar issues. Letter D is incorrect because retrospective audits take place after the client has been discharged, not during care delivery. So you need to focus on understanding different audit types and when each type is used to better distinguish correct responses. Number 43. A nurse is providing education to a client diagnosed with Graves' disease who has just been prescribed propranolol. Which of the following statements made by the client demonstrates that the teaching has been effective? A. Propranolol assists in enhancing blood circulation to my thyroid gland. B. Propranolol helps in controlling excessive glucose levels in my bloodstream. C. Propranolol will help reduce my tremors and rapid heartbeat. And D. Propranolol encourages a reduction of thyroid hormones in my body. The correct answer here is letter C. We know that the propranolol functions as a beta blocker that can reduce the heart rate and also mitigates the tremors. So if you selected letter A, this is incorrect. The propranolol lowers blood pressure but does not enhance blood flow to the thyroid gland. Letter B is also incorrect because propranolol does not aid in preventing hyperglycemia. And D, propranolol does not facilitate a decrease in thyroid hormone levels. Number 44. A 10-year-old child diagnosed with influenza is going to be cared for at home by their parents. What important information should the nurse provide during teaching? A. The child should be kept away from all susceptible individuals for 2 weeks. B. Complete the entire 10-day course of antibiotics as prescribed. C. If the child has a sore throat, seek immediate care at the emergency department. And D. Administer only acetaminophen for any pain or fever. Your answer should only be letter D. Only acetaminophen should be used for fever or pain management in this case because it's safe for the child with influenza. Letter A is incorrect. The communicability of influenza significantly decreases after 5 days of symptom onset. Letter B is also incorrect because antibiotics are ineffective against viral infections like influenza, which means the statement is misleading. And letter C is also incorrect because a sore throat is a common symptom of influenza and does not typically warrant emergency care unless severe symptoms develop. Now, you need to understand the differences between bacterial and viral infections, especially regarding treatment options and communicability, to effectively answer this test question. Number 45. What reproductive advice should the nurse give a 30-year-old woman recently diagnosed with Hodgkin's disease? A. Fertility will remain the same after treatment. B. Use birth control for at least 2 years after treatment. C. All clients become sterile from treatment and should consider adoption. D. Treatment will cause only temporary or disruption to menstrual cycles. The correct answer here is letter B. Birth control is recommended during and for 2 years after Hodgkin's treatment. As we know that chemotherapy and also radiation can have carcinogenic effects that could impact a fetus, making sure that pregnancy is prevented around this time. If you selected letter A, this is incorrect. Many clients can experience fertility issues, including premature menopause. So this statement is misleading. Now, for letter C, this is also incorrect because not all clients become sterile. Fertility outcomes can vary from one person to the next, and making absolute statement is inappropriate. And also letter D, this is incorrect. Menstrual cycle disruption can occur, but the potential for more lasting impacts on fertility can happen. So when you're answering this test question, you need to be cautious of absolute terms like all when evaluating options, as this can often make statements incorrect unless universally applicable. Number 46. A nurse informs a patient with alcohol use disorder about a new prescription for naltrexone, Rivia, or Vivitrol. Which statement from the patient shows that the teaching was effective? A. This medication will completely eliminate my desire for alcohol. B. I need to take this medication only when I feel like drinking. C. The medication is part of a comprehensive treatment plan to help me stay sober. And letter D. I should avoid using any products that contain alcohol, like cough syrup or aftershave. The correct answer is letter C. The reason for that is that naltrexone helps reduce cravings and it blocks pleasurable effects associated with alcohol use. And this is a very important part of a broader strategy to maintain sobriety in this patient. Now, if you selected letters A, B, and D, these are all incorrect. For A, while we know that naltrexone can reduce the cravings, it may not fully eliminate them. And so this comment indicates a misunderstanding of the medication's role and suggests unrealistic expectations. Now, if you selected letter B, this is also incorrect. Naltrexone is typically prescribed to be taken consistently, not on as needed basis or not as on demand basis. This also indicates a lack of understanding of its proper use. Now, letter D is also incorrect because while avoiding alcohol is advisable for recovery, naltrexone does not cause adverse reactions when used with alcohol, making this statement reflect a misunderstanding of the medication's action. So, if you can successfully answer this question, you should assess the patient's understanding of the medication adherence and also the role of the medications within a comprehensive treatment plan. For number 47, a nurse is teaching the parents and their 11-year-old child about caring for the child diagnosed with acute glomerulonephritis at home. Which statements made by the child demonstrate understanding of the instructions? Select all that apply. A, I need to avoid eating salty foods like potato chips. B, I won't be able to attend school for a week because I might spread germs. C, I will have to stay away from soccer practice for an extended period. And D, I'll need to visit the doctor frequently in the coming months. And E, I should remain in bed at home except when I need to use the bathroom. The answers here are letters A, C, and D. Because letter A, children with AGN are typically placed on salt-restricted diets to manage fluid retention and blood pressure. Okay. And also letter C, the statement is also correct. Until urinalysis results return to normal, children are advised to avoid contact sports to prevent complications. And letter D is also correct because frequent doctor visits are necessary for monitoring the child's condition, including regular urinalysis and blood pressure checks. If you select letter B, this is incorrect because children with AGN are not generally contagious. If they are still positive for Streptococcus pyogenes, they will be treated with penicillin and will no longer be contagious after 1 day of treatment. And letter E is also incorrect because children with AGN do not usually require strict bed rest. Instead, they may need to limit activity but can ambulate as they feel able. So, for this test question, you need to engage both the child and the parents in discussions to ensure understanding. And children often spend significant time at school, so involving them in their care plan is very important. Let's have number 49. A nurse is set to administer IV cyclophosphamide to a patient diagnosed with Hodgkin's disease. What additional medication should the nurse anticipate giving to mitigate the adverse effects of cyclophosphamide? A, uroprotectant agent like Mesna. B, pain relievers such as morphine. C, diuretics such as furosemide. And D, antihistamine such as diphenhydramine. The correct answer here is letter A, Mesna. This is specifically used as a uroprotectant to prevent hemorrhagic cystitis, which is a known adverse effect of cyclophosphamide. We know that cyclophosphamide can cause toxic byproducts, which can lead to the bladder irritation and also the inflammation if not properly neutralized. And so the action of the Mesna is to bind to these byproducts in the urinary tract, and this will reduce the risk of bladder damage. Now, if you select letter B, pain reliever such as morphine, we know that morphine is a powerful pain medication, but this is not a standard part of cyclophosphamide administration. The cyclophosphamide does not generally cause direct pain that would necessitate the routine use of opioids. And pain relief is not targeted toward preventing chemotherapy-related bladder irritation or inflammation, which is the primary adverse effect addressed with cyclophosphamide and mesna. If you selected letter C, diuretic, like furosemide, this is not indicated to prevent the specific adverse effect of the cyclophosphamide. And letter D, antihistamines such as diphenhydramine. This is also incorrect. We know that this is used to manage allergic reactions, often associated with hypersensitivity to some medications. But cyclophosphamide is not known for causing severe allergic reactions. So this is incorrect option. Now, your strategy here is to focus on the phrase mitigate the adverse effect of cyclophosphamide. So this suggests that the correct answer should be a medication that addresses a specific side effect associated with this medication administration. Now, let's have a number 49. While preparing for a patient education session, the nurse is approached by a UAP who inquires about the inheritance pattern of hemophilia A. How would the nurse respond? A, it's an inherited X-linked disorder. B, a lack of clotting factor 8 causes it. C, people are born with hemophilia A. And D, mothers pass the gene to their sons. The answer here is letter D. Hemophilia A is passed from the mother to son via an X-linked gene, making this a clear explanation for the UAP. Now, if you selected letter A, though accurate X-linked recessive disorder, it may be too technical for explaining inheritance to the UAP. If you select letter B, this describes the disease's mechanism but doesn't address its inheritance. And letter C is incorrect. Being born with it, it is true, but doesn't explain how it's inherited. So your test-taking strategy here is to seek the most straightforward explanation suitable for the person asking the question. So in this case, the UAP, you need to provide them non-complex medical language. Number 50, a 45-year-old female client is admitted to the hospital with a diagnosis of idiopathic thrombocytopenic purpura, or ITP. Which finding would the nurse anticipate in a client with idiopathic thrombocytopenic purpura? A, small red or purple spots on the chest, arms, and neck. B, normal capillary refill time under 3 seconds. C, enlarged spleen. And D, oxygen saturation of 95%. The answer here is letter A. Those petechiae, or what we call small red or purple spots, are common in ITP due to bleeding of the tiny blood vessels near the skin surface. Letter B is incorrect because capillary refill under 3 seconds is a normal finding and it doesn't indicate ITP. Letter C, enlarged spleen is not a characteristic of ITP, though the spleen may be removed if steroid treatment fails. And letter D, oxygen saturation of 95. We know that ITP affects bleeding but does not impact oxygen delivery to the tissues at this rate. And so your task here is to recognize that term thrombo, which is related to platelets. And this will help you guide to select that answer involving bleeding, as we know that platelet disorders often will cause bleeding symptoms. Number 51. A 45-year-old female client is admitted to the hospital with a diagnosis of idiopathic thrombocytopenic purpura. Which finding would the nurse anticipate in a client with idiopathic thrombocytopenic purpura? Looks like this is a repeated question. Let's skip that one. Number 52, a nurse is caring for a patient receiving interferon alpha 2b for malignant melanoma. What adverse effects should the nurse monitor for? Select all that apply. A, ringing in the ears. B, muscle pain. C, nerve damage. D, decreased bone density. And E, mood changes. The answers should be letters B, C, and E, because B, muscle pain and flu-like symptoms, are common side effects of interferon alpha 2b. And the acetaminophen may help alleviate these symptoms. Now, for letter C, nerve damage or peripheral neuropathy is a potential side effect of interferon alpha 2b, which requires monitoring for falls and also injury prevention. Now, for letter E, this is also correct, mood changes, because we know that depression and other mental status changes are also known adverse effects of the interferon alpha 2b treatment. So we are going to assess this patient for suicidal ideation. So letter A is incorrect. Tinnitus is not associated with interferon alpha 2b therapy. And letter D, bone loss is linked to treatments like gonadotropin releasing hormone agonist, not interferon alpha 2b. Number 53, a 68-year-old client is preparing for a hip replacement surgery and plans to donate their own blood in advance to ensure a supply for potential transfusion during or after the procedure. The nurse anticipates the client will need medication to support this autologous blood donation. Which medication should the nurse expect to administer? A, prednisone. B, zithromax. C, Ativan. D, EpiPen. The correct answer is letter D, EpiPen or erythropoietin, which can stimulate red blood cell production, and this can allow the client to store their own blood before surgery. Letter A, prednisone is a steroid, and this can delay healing and it does not boost red blood cell production. Letter B, zithromax is an antibiotic. It doesn't increase the red blood cell count. And same thing with letter C. This is a tranquilizer. It does not affect blood cell production. Now, in this test question, you need to pay to the prefix auto to understand the autologous as self, which indicates a need for a blood production booster. And so we know that EpiPen or erythropoietin is something that can stimulate the bone marrow to produce the red blood cells. Let's have number 54. When assigning clients on a medical floor, which client should the charge nurse assign to the LPN? A, client 2 hours post bronchoscopy. B, client with a jugular vein distension and low blood pressure who has chest tubes. C, client with hemoglobin of 9 grams per DL and hematocrit of 20% with a hemothorax. And letter D, client with a pulse oximeter reading of 91 with pneumonia. The correct answer here is letter A, a client 2 hours post bronchoscopy, because this is under the scope of the LPN's practice, and the patient here is stable. Now, if you select letter B, the jugular vein distension and hypotension can indicate tension pneumothorax, which is a potential emergency which can require RN skill. Letter C is also incorrect. Low hemoglobin and hematocrit suggest that client may be unstable. And of course, this patient has a hemothorax, so this really require an RN skill. Letter D, oxygen saturation of 91% indicates hypoxia, meaning the client is not stable enough for LPN care. So your strategy here is to look for those suitable clients that are stable for the LPN to take care of, and those patients that will require less advanced assessments Okay, should be given to the LPN. Number 55. A nurse is giving IV amphotericin B to a client with a systemic fungal infection. Which lab values should be monitored? Select all that apply. A, serum creatinine. B, serum albumin. C, serum potassium. D, hematocrit. And E, serum amylase. This is a select all that apply. Your answers should be letters A, C, and D. Letter A is incorrect because amphotericin B can cause nephrotoxicity. So we need to pay attention to the kidney function, and we need to monitor the patient's creatinine levels periodically. Now, letter C is also another uh, thing that you need to monitor because the amphotericin B primarily targets the fungal cell walls, but it can also attach to the cholesterol in human cells. When it binds to the kidney cells, it creates pores that will allow potassium to leak out, in which can result to hypokalemia. Letter D, hematocrit. We know that amphotericin B may suppress the bone marrow, and this will necessitate monitoring of the hematocrit. Now, if you selected letter B, serum albumin is not affected by amphotericin B, and letter E, serum amylase levels are not related to amphotericin B's adverse effects. So, I want you to link the adverse effects of these medication, nephrotoxicity, hypokalemia, and bone marrow suppression. Item number 56. The nurse suspects a 28-year-old client developing acute respiratory distress syndrome, or known as ARDS. Which assessment finding supports this diagnosis? A, low arterial oxygen despite high oxygen concentration. B, clear bilateral breath sounds with an oxygen saturation of 95%. C, dyspnea, tachycardia, and anxiety. And D, jugular vein distension and frothy sputum. The correct answer here is letter A. ARDS typically involves severe hypoxemia that doesn't respond well to increased oxygen levels due to compromised alveolar membrane function. Letter B is incorrect because the clear breath sounds and normal oxygen saturation do not indicate ARDS. And letter C, while these can be early signs of ARDS, they are not definitive and may indicate other conditions. And letter D is also incorrect because JVD and frothy sputum are more indicative of heart failure, not ARDS. So your strategy here is to know that this problem involves hypoxemia that is unresponsive to high oxygen delivery, which helps differentiate it from other conditions. Number 57. When creating an orientation plan for newly licensed nurses, which of the following should a nurse manager include? Select all that apply. A, preceptorship assignment. B, orientation to facility policies and procedures. C, social integration into the unit's culture. D, overview of budget management. And E, skill competency evaluation. And F, training on computerized charting. Your answer here should be letters A, B, C, E, and F. So letter A, assigning a preceptor provides new nurses with on-the-job guidance, and it will help them in their transition. And letter B, the knowledge of the facility policies and procedures is very important for compliance and also the quality of care. And letter C is also important because socialization into the unit's culture can help new nurses adapt to the team and also the environment. And letter E, assessing skill proficiency ensures that new nurses are equipped with required competencies. And letter F, familiarity with electronic charting is very important in modern clinical settings for efficient documentation. So if you selected letter D, that is incorrect because budget management is generally a responsibility of nurse managers, and it's not typically included in orientation for newly licensed nurses. Now, your strategy here is to focus on responses that directly support the clinical and organizational transition of newly licensed nurses. Number 58. A 32-year-old male client is discharged after a transsphenoidal hypophysectomy. Which instructions should the nurse provide? Select all that apply. A. Sleep with the head of the bed elevated. B. Use a humidifier in the room. C. Be cautious with oral care. D. Follow a full liquid diet until the healthcare provider advises otherwise. And E. Contact the healthcare provider if a cold or fever develops. The answers are letters A, B, C, and E. We know that elevating the head can reduce the cerebrospinal fluid pressure, and it will also help with drainage. Letter B is another good intervention because we know that humidified air can help keep the nasal passages from drying out after the surgery. And letter C, oral care should be done carefully, and we need to avoid brushing near the surgical site to prevent injury. And letter E, fever or cold could indicate infection, so we need to contact the healthcare provider right away. Now, if you selected letter D, this is incorrect. A regular diet is typically allowed unless otherwise advised by the healthcare provider. So in this test question, remember that postoperative instructions can include infection prevention and precautions around the surgical area. So keep in mind of those things. Now, let's have number 59. A client suspected of having meningitis is scheduled for a lumbar puncture. What preparatory actions should the nurse take? Select all that apply. A. Ensure informed consent is obtained. B. Ask the client to empty their bladder before the procedure. C. Position the client on their side with the back arched. D. Instruct the client to breathe quickly and deeply during the procedure. And E. Explain what the client should expect during the procedure. Your answers should be letters A, B, C, and E. We know that informed consent is required for this procedure, and also emptying the bladder can increase the client's comfort, and the side lying position can also help separate the vertebrae for easier needle insertion. And letter E, providing clear information can help the client stay calm and also be prepared for the procedure. So if you selected letter D, this is incorrect. Rapid breathing is not advised as it may increase cerebrospinal fluid pressure, and so normal breathing is encouraged and is preferred at this time. Now, your strategy here in correctly answering this test question is to remember that, especially in an invasive procedure, always consider consent, comfort, positioning. These are critical elements. Now let's have number 60. A nurse is contributing to a quality improvement review of commonly performed procedure. Which data would best indicate the procedure's effectiveness? A. Client satisfaction with the procedure's performance. B. Frequency at which the procedure is carried out. C. Accurate records on how the procedure was completed. And D. Rate of complications associated with the procedure. The correct answer here is letter D. Tracking complication rates provides better insights into the procedure's effectiveness, as a lower complication rate typically reflects higher success. Now, if you selected letter A, although client satisfaction is important, it does not provide a direct measure of the procedure's success. Same thing with letter B. This is incorrect. Frequency of procedure use may help in resource planning, but does not reflect its efficacy. Letter C is also incorrect. Accurate documentation is valuable, but does not confirm the procedure's success or quality. So Your strategy in answering this test question is to prioritize that option that can directly measure outcomes of care to determine effectiveness. Let's have number 61. A nurse is preparing to administer IV ciprofloxacin to a client with cystitis. Which action should the nurse take? A. Use the primary IV line for the infusion. B. Administer in a concentrated solution. C. Infuse over a 60-minute period. And D. Select a small peripheral vein. The correct answer here is letter C. Infuse over 60-minute period, because this can reduce the irritation to the vein, which is a critical practice with this type of medication. Letter A is incorrect. Ciprofloxacin should not be infused with other medications to prevent interaction. So you should not use the primary IV line. Letter B is incorrect. What you should do here is to administer a diluted solution, not concentrated, to minimize vein irritation. And letter D is also incorrect. A larger vein is preferred instead of a small peripheral vein to avoid irritation and to reduce phlebitis risk. So your focus in this test question is to minimize vein irritation by using proper dilution, timing, and also proper vein selection in this kind of medication. 62. The nurse is caring for a client diagnosed with ARDS. Which actions should be implemented? Select all that apply. A. Turn the client every 2 hours. B. Check urine output every shift. C. Place the client in Fowler's position. D. Assess the client's level of consciousness. And E. Administer IV fluids as prescribed. Your answers should be letters A, C, D, and E. We know that regular repositioning prevents complications from immobility, and also Fowler's position can help with lung expansion, assisting in easier breathing. And also monitoring the consciousness level is very important, as changes can indicate worsening hypoxemia. And letter E, IV fluids are managed to avoid fluid overload in ARDS. Letter B is incorrect. As we know that urine output should be checked more frequently rather than once per shift, not once per shift. It should be checked every hour because of the ARDS related risks such as fluid imbalance. So when you're answering this test question, you should focus on those interventions that address respiratory support and also monitor complications from immobility and also hypoxemia. Let's have number 63. A nurse is assisting with discharge planning for a client. Which of the following actions should be included? Select all that apply. A. Arrange for printed instructions on medication administration. B. Assess the need for any medical equipment at home. And C. Offer information on community agencies for support services. And D. Provide a summary of medications used during hospitalization. And E. Emphasize the importance of attending follow-up appointments. The correct answers are letters A, B, C, and E. A. Written instructions on the medication use will help ensure that the patient can do proper self-administration at home. Letter B is also correct because evaluating the need for the medical equipment can help in continuity of care and also the client safety after their discharge. Now, letter C is also correct. The information and community resources connects the clients with supportive services if needed. And the same thing with letter E. Follow-up appointments are also important for ongoing care and also the monitoring of the client's condition. However, we have letter D that is incorrect because instead of just listing all medications used in the facility, provide only those currently prescribed to avoid confusion. Now, your test taking strategy here is to consider those answers that support continuity of care and client understanding after discharge. Let's have number 64. A client with ARDS is on a ventilator and the high pressure alarm sounds. Which action should the nurse take first? A. Assess the tubing for kinks. B. Check the ET tube lip line. C. Suction for secretions. D. Sedate the client. The correct answer here should be letter A. Checking for kinks in the tubing is a very quick, it's non-invasive way to resolve high pressure alarm. And for options letter B, C, and D, these are incorrect. For letter B, the endotracheal tube position should be checked regularly, but this does not directly relate to a high pressure alarm. For letter C, suctioning may be necessary, but it's more invasive than checking for kinks. And for letter D, sedation may reduce balking, but should be a last resort after other options are exhausted. So when you're dealing with ventilator alarms, start with the least invasive action to troubleshoot effectively. Let's have number 65. A nurse caring for a 62-year-old male confused client after a hip replacement surgery. The client frequently moves the operated leg in ways that could cause dislocation and repeatedly tries to leave the bed. After assessing the need for restraints, which actions should the nurse take? Select all that apply. A. Attach the restraint to the bed frame. B. Obtain a provider's order for the restraints. C. Request a family member's consent for restraint use. D. Secure the restraint to the side rail using a double nut. And E. Ensure there's a room for only one finger between the restraint and the client's skin. The answers are letters A, B, and C. Restraints should be attached to a movable part of the bed frame to prevent injury if the bed position is adjusted. Letter B is also correct. A provider's order is required for restraint use, typically within an hour after the decision is made. And letter C, informing the family and obtaining consent when possible is encouraged to ensure transparency about the restraint use. If you selected letter D, this is incorrect because restraints should be secured with a quick release, not to allow for fast removal in emergencies. If you selected letter E, this is also incorrect. There should be enough space to fit 2 fingers between the restraint and the client to prevent skin damage. Let's have number 66. A nurse is preparing a discharge instructions for a female patient who has been prescribed trimethoprim sulfamethoxazole. Which piece of information should the nurse provide? A. Continue taking the medication if you become pregnant. B. Limit your fluid intake while using this medication. And C. Take the medication on an empty stomach. And D. Discontinue use once symptoms improve. The correct answer is letter C. The patient can take the medication with or without food, but it's generally recommended to take it on an empty stomach to enhance absorption. If you selected letter A, this is incorrect because the trimethoprim sulfamethoxazole during pregnancy use can lead to fetal complications, including birth defects. Letter B is also incorrect. Here, the patient needs to have adequate fluid intake, at least 8 ounces of glasses of water daily, which is necessary to prevent crystalluria and also kidney damage while taking this medication. And letter D, the patient should complete the entire prescribed course of treatment to ensure all bacteria are eradicated and to prevent a return of the infection. Number 67. A charge nurse reviews morning lab and respiratory data on several clients. Which result needs the most urgent attention? A. A client with COPD showing ABG results, pH 7.35, partial pressure of carbon dioxide 55, bicarbonate of 30, partial pressure of oxygen 77, and B, a post-knee replacement patient with a pulse oximetry reading of 89%. C, a client receiving a second unit of blood with hemoglobin of 9 grams per DL and hematocrit of 28. And D, a client with stage 4 heart failure and a BNP of 100 picograms per ml. The answer here is letter A. The patient with a pulse oximetry reading of 89% indicates low oxygen saturation, and this can put the client at risk for respiratory distress, which require immediate intervention to prevent further complications. If you selected letter A, this is incorrect because the client's ABG values indicate compensated respiratory acidosis, common in COPD patients, and not immediately concerning. If you selected letter C, the client is receiving blood to address the low hemoglobin and also hematocrit levels. This finding is also expected. And letter D, a BNP of 100 is within acceptable limits. Even in an advanced heart failure, this one does not require urgent action. So your strategy here is to focus on identifying critical lab and respiratory findings that indicate immediate risk to determine priority response. Let's have number 68. During an orientation, a nurse manager explains the role of incident reports. Which details should the nurse manager include? Select all that apply. A, document a factual account of the event in the client's record. B, the client should sign as a witness on the incident report. C, incident reports include a description of the event and actions taken. D, a copy of the incident report should be placed in the client's record. And E, the risk management team will investigate the incident. The answers are letters A, C, and E. Letter A, documentation in the client's health record should provide an objective description of the event. Okay. Now let's have letter C. Incident reports should outline what happened and what actions were taken to address the situation. And letter E, the risk management investigates incidents to enhance safety and also quality assurance practices. Now, letters B and D are incorrect. For B, the incident report is for internal use and not shared with or signed by the client. And also letter D, incident reports are kept separate from the client's record to maintain confidentiality. Now, we have number 69. The nurse is caring for a client recovering from a sickle cell crisis who mentions plans to visit Banff National Park this summer. What is the most appropriate response from the nurse? A, Banff National Park sounds like a fantastic summer destination. B, have you considered consulting your doctor about your travel plans? C, it's best to avoid traveling to high altitude areas. And D, what makes you want to visit Banff National Park? Your answer here should be letter C, because the high altitude locations have lower oxygen levels, which will increase the risk of triggering a sickle cell crisis, making such areas unsafe for clients with sickle cell disease. Now, if you selected letter A, this is incorrect. While the statement is supportive, but this response misses an opportunity to educate the client on the risks associated with high altitudes. B is also incorrect because delegating the concern to the doctor is unnecessary when the nurse can provide direct guidance on the risk of high altitude travel. And letter D, asking why the client wants to go does not address the health risks involved and does not prioritize client education. So your strategy here is to focus on the response that provides client education specific to their condition and teaching and highlighting safety related to high altitude and their condition, which is sickle cell disease, makes option C the best answer. Let's have number 70. A client had a right-sided chest tube inserted 2 hours ago for a pneumothorax. What action should the nurse take if there is no movement in the water seal chamber? A. Arrange for an immediate chest x-ray. B. Increase the wall suction. C. Inspect the tubing for any obstructions or kinks. And D. Continuously monitor the client's oxygen saturation. Your answer this time should be letter C. Inspect the tubing for any obstructions or kinks, because after 2 hours, the lack of fluctuation in the water sealed chamber may indicate that an obstruction in the tubing has occurred. It could be that there's been maybe clotting, and you should inspect the tubing for any kinks or blockages. Now, if you selected letter A, ordering an x-ray is not the first step in assessing an issue with the chest tube. Same thing with letter B. Increasing the wall suction does not address the root cause of the lack of movement in the water seal. And for letter D, although monitoring the oxygen levels is very important, it does not resolve the issue of non-fluctuation in the water sealed chamber. So I want you to use the process to prioritize the action here. Start with the assessment by checking for physical causes such as kinks before ordering any diagnostic tests or doing any other interventions such as B or letter D. Let's have number 71. When preparing to administer medications, which of the following should the nurse question? A. Administering the anticoagulant warfarin to a client with an INR of 1.8. B. Providing regular insulin to a client with a blood glucose of 220 milligrams per DL. C. Initiating heparin infusion for a client with a PT/PTT of 13/96. And D. Giving a calcium channel blocker to a client with a blood pressure of 110/80 mmHg. The correct answer here is letter C. The heparin's therapeutic effect is usually monitored by PTT, and a value of 96 seconds exceeds the target range, which is typically 1.5 to 2 times the normal, around 58 to 78 seconds. So this suggests that the patient has bleeding risk. Now, letter A is incorrect. An INR of 1.8 indicates that warfarin is still below the therapeutic range for anticoagulation, which is around 2 to 3 range. So administering it is safe. Now, letter B, blood glucose level of 220 milligrams per DL is above normal, justifying the need for the use of the regular insulin. And letter D, a blood pressure of 110/80 mmHg is within the normal range, so a calcium channel blocker may still be safely administered if prescribed. So in this question, you need to recognize abnormal lab values and prioritize safely. And you also need to recall about the therapeutic range for the PTT, which will help you identify the option letter C as the correct answer. Let's have number 72. A client's right-sided chest tube accidentally dislodges from the pleural space. What action should the nurse take first? A. Contact the healthcare provider for urgent reinsertion. B. Instruct the client to take shallow breaths until the tube is inserted. And C. Take no immediate action and assess the client's respiratory status every 15 minutes. And D. Secure a petroleum jelly dressing over the insertion site on 3 sides. The correct answer is letter D. Taping a petroleum jelly dressing on the 3 sides will allow air to escape during exhalation and reduces the risk of attention pneumothorax by preventing air from entering the pleural space. If you selected letter A, notifying the provider is necessary but does not address the immediate need to prevent air from re-entering the pleural space. And for letter B, this is also incorrect. The client should maintain normal breathing, as we know that shallow breathing does not mitigate air entry. And for letter C, immediate interventions is required to avoid a serious complication, not just monitoring. Now, your strategy here is to look for that action that can address immediate safety concern. So you need to prioritize the intervention that can protect the client from potentially having those fatal complications. Let's have number 73. A nurse is providing care to a patient with type 2 diabetes who complains of a headache, feeling jittery, and nervousness. Which intervention should the nurse prioritize? Select all that apply. A. Provide the patient with a glass of orange juice. B. Provide or check the patient's blood pressure and apical pulse. C. Verify the last time the patient received anti-diabetic medication. And D. Measure the patient's blood glucose level. E. Administer insulin as per sliding scale orders. The answer should be letters A, B, C, and D. Why letter A? Providing the patient orange juice can actually quickly raise their blood sugar levels if the patient is experiencing hypoglycemia. So this is a very critical intervention this time. Letter B is also correct. Checking the blood pressure and heart rate can give you a better understanding of the patient's condition, as we know that hypoglycemia can also impact their vital signs. And letter C, knowing the timing of the last anti-diabetic medication is also crucial in order for us to assess for possible hypoglycemia due to the medication effects. And letter D, checking the blood glucose is essential to determine if the symptoms are due to the low blood sugar. Now, if you select the letter E, this is incorrect. This only is going to be administered if the blood glucose levels are high. Since the patient's symptoms suggest hypoglycemia, the insulin could worsen the condition. So when you are going to encounter this type of question, especially with the symptoms such as jitteriness, nervousness in a diabetic patient, think of hypoglycemia. So you need to choose those answers focusing on assessing and also treating low blood sugar, not those actions that can further decrease the blood sugar. Let's have number 74. A newly diagnosed patient with type 2 diabetes prescribed an oral hypoglycemic calls the clinic reporting yellow discoloration of the eyes. What should the nurse do? A. Arrange an appointment for the patient to visit the healthcare provider. B. Inquire if the patient has any history of alcohol use. And C. Ask if the patient has been in contact with anyone who has hepatitis. And D. Check if the patient is currently taking digoxin. Your answer here should be letter A. The yellowing of the sclera indicate liver involvement. And so this is a potentially related to the use of the oral hypoglycemic medication. And the nurse here should advise the patient to see the healthcare provider ASAP for assessment. Now, if you select letter B, inquire if the patient has any history of alcohol use. Although we know that alcohol use can affect liver function, but this assumption is premature without further evaluation of the medication's effect on the liver. Letter C is incorrect. While hepatitis can cause jaundice, the patient's medication is a more immediate concern, and the priority here is a medical evaluation. Now, letter D is incorrect because digoxin toxicity leads to visual disturbances such as yellow tinged vision, but not yellowing of the sclera. Now, your strategy to accurately answer this question is to identify priority actions when a new medication may be affecting a patient, and choose the intervention that ensure the patient gets immediate assessment rather than focusing on unrelated conditions. Let's have number 75. A 55-year-old patient with a history of diabetes insipidus is admitted to the hospital in acute distress. Lab results show 156 milliequivalents per liter, serum sodium levels, and 1.008 urine specific gravity. What interventions should the nurse prioritize? Select all that apply. A. Administer an IV of a lactated ringer solution. B. Place an indwelling urinary catheter. C. Track intake and output on each shift. D. Monitor the urine specific gravity. And E. Give furosemide via IV push. Your answers here should be letters A, B, and D. We know that patients with diabetes insipidus lose excessive amounts of diluted urine due to their inability to retain water. And so fluid replacement is very important to prevent dehydration and also to maintain adequate volume. And so the administration of lactated ringers can be appropriate for this case. Now, if you selected letter B, an indwelling catheter can allow you to accurately measure and also monitor the urine output, which is very important in managing DI or the diabetes insipidus. Because we know that continuous voiding can be exhausting, and a catheter can also help prevent further fatigue from frequent bathroom trips. Letter D is also correct because monitoring the urine specific gravity is also key for assessing the concentration of the urine, which will help you evaluate the effectiveness of the treatment and also the body's ability to retain water. Now, if you selected letter C, track intake and output on each shift, this is something that you should do every hour, not every shift, because of the rapid fluid loss. And letter E is also incorrect because we know that furosemide is a diuretic. It will increase their urine output. It can worsen the patient's dehydration and also fluid imbalance. So when you are treating the diabetes insipidus, your focus should be on the interventions that should address severe fluid loss and also interventions that include monitoring for the dehydration. And you need to avoid treatments that could increase urine output. So letter E is counterproductive for the diabetes insipidus management. So that is the end of our Q&A today. I hope that you have learned from this session, and I want you to really recall, and if you have really made some errors in answering some of the questions here, I want you to go back into those items and to master the material in order for you to be much more prepared for the examination. Now, I want you to keep pushing forward and stay confident. So I'll see you again in our next video session. Thank you.